Go. First thing you're gonna do is perform hand hygiene and put on PPE. Then I'm gonna introduce myself to the patient, and then I'm gonna identify the patient. So can you tell me your name and birthday?
My name is Jason, and my birthday is July 6th.
Okay, check the MAR for match, and then provide privacy by closing the door or the curtain. And then the first thing I'm going to do is assess the patient's physical appearance. Check if there is any signs of acute distress, if they're alert and oriented, and stop. And I'm also going to check if their height and weight is congruent to the patient's age and their BMI. Then I'm going to check their behavior. Sit down correctly. I'm going to check if they're well groomed and dressed appropriately for the weather, and if their speech is clear. So can you tell me where we are?
Texas.
Okay. And then I'm going to check the range of motion, any signs of gait. So I'm going to tell the patient to stand up. Stand up. Now, do you have any pain anywhere?
No.
Okay. I'm going to tell you to touch your toes. Can you just touch your toes? Okay. Now, I'm going to take off the patient's shoes, and I'm going to weigh him, and at this time I would also assess his height. And then I would, I'm going to assess the waist circumference. You can sit down. 21 inches. Okay. So then I'm gonna check the head, eyes, ears, nose, mouth, and throat. Okay. First, I'm gonna inspect the head for any bumps, bruises, any abrasions or lesions, and then I'm going to palpate. It appears normal cephalic. And then I'm gonna inspect the hair for the color, length, any balding. And then eyes, I'm gonna check for light accommodation. Okay, so just look forward. I'll dim the lights, and I'm gonna do this first with this eye and then that eye. Okay, just keep looking straight. Pupil constricts. Then I'm going to test for pupillary accommodation. So I'm going to first ask you to look at the pen. Now look at the wall. Now back at the pen. Okay. Now I'm going to do extraocular movement. So just follow the pen, okay? With your eyes, not your head. Okay, now follow it. Just keep looking at it. Okay. And then I'm going to inspect the eyes. The eyes are the sclerus white. And then I'm going to inspect the ears and the maxillary. And then palpate the ears for any abrasions, lesions, rashes. It appears normal. And then I'm gonna inspect the nose, and then palpate the maxillary sinuses for any swelling. Now, can you look up a little bit so I can look at the patency of the nerves? Oof. Okay, now then I'm gonna inspect the lips. They're pink, moist. Now open. Stick your tongue out. This time I would use a tongue blade to further inspect. Now say ah. Inspect movement of the uvula in the back. Then I'm going to inspect for the enlarged lymph nodes. Stop, dude. Okay. Then I'm gonna inspect the neck. Look straight. Dude, I need to look at your neck. then I'm gonna palpate the neck and the trachea, and then I would check for skin trigger. Wow.
Can't stop it.
Now, next thing I'm gonna do is check your upper extremities, okay, your arms. So I'm gonna ask you to put your arms forward, sit down, your arms forward.
Like this?
Yeah. Now put your palms up.
Mm.
Now I'm gonna tell you to go like this, okay?
Mhm.
Do it again, towards my hands. Keep doing it. Alright. Now I'm gonna ask you to go like this, assessing the range of motion. Now like this with your wrists. Around. Okay. Then I'm gonna check the.
Earring.
Oh, wait.
Mm.
So while I'm checking the pulses, I'm gonna go back and check your carotid pulse on both hands. Then I'm gonna check your brachial pulse and your radial pulse. Skin temperature appears normal, warm. Now what I'm gonna do is check your posterior, your back. So just turn around. So I'm just inspecting for any abnormalities or any signs of asymmetry. So it appears symmetrical. Every time I go like this, say 99, okay? Go.
99.
Okay, now with my thumbs at the T9, T10, I'm gonna take a deep breath, noting any signs of asymmetry. And then I'm going to auscultate. So, wait, let me palpate. So, when I hear them, just take deep breaths, okay? Every time I move it, okay? Deep breath. Again. 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 Again.
You're just making me hold it.
I know. Again. Okay. Okay, so now I'm gonna check your. You turn around. Check your thorax. First thing, I'm gonna inspect the.
Latina.
No, hold on. I'm gonna inspect your bronchial, your pulmonary, aortic, tricuspid, pulmonary, aortic, tricuspid, and your apical. So first I'm gonna know any abrasions, lesions, any redness in the skin, and then I'm gonna inspect, then palpate, and then auscultate. So just relax, because I can hear your heart, okay? Ready? So first I'm gonna check the pulmonary and aortic, then I'm gonna go to the tricuspid and then the apical. Make sure you can see. And the tricuspid and the apical. Okay, next. I would expose the chest at this time to have a better view, to see if there's any asymmetry, any lesions and abrasions. Now I'm going to check your lungs, okay? So it's going to be the bronchiovesicular, and the vesicular. So first, just inspecting and then palpating, and then I'm going to auscultate. So I'm going to hear your lung sounds. Just take deep breaths, okay? Ready? Again. Again. Okay. So now I'm going to tell you to lie down, because I'm going to hear your abdomen, okay? Lie down. Now, first thing I'm going to do is inspect the area for any abnormalities. It's important with the bowel to first inspect, then auscultate, then palpate, because palpating could actually move things around and change the sounds of the bowel. So first thing I'm going to do is inspect, and then I'm going to auscultate, starting at the lower quadrant, and then moving up to the side and then down. Do you have any pain?
No.
Okay.
That was crazy.
If there's pain in any area, you palpate that area last and auscultate that area last. Wait, now I'm gonna palpate. The right upper quadrant has it's more of a tympanic. I'm not doing percussion. Now, I'm going to check your lower extremities. First thing I'm gonna do is your legs. Okay, extend them. I'm gonna feel for your sacral pulse. It's gonna be somewhere here. Next thing I'm gonna do. I forgot. Back in the upper extremities, check for skin trigger and capillary refill and assess the nails. They're a little bit dirty. Okay. Now I'm gonna ask you to squeeze my hand with 2 fingers. Okay. Now with your feet, I'm gonna check your popliteal, and then I'm gonna check your pulse down here, and then I'm gonna stand up. I'm gonna check the range of motion. So I'm gonna do straight leg movements. Just go straight like that with one leg at a time. Now the other one. Now laterally, go to the side like that. Now the other foot. Now push against my arm. Push, like bring up your leg like that. Okay, now the other one. Okay, now I'm gonna tell you to do plantar flexion, dorsiflexion. So just go like this with your ankle, now with your knee. Now with the other leg, plantar flexion. Okay. So after that,
Done.
okay, I would assist the patient to a comfortable position,
Bye.
and I would lower the bed, place the call light, remove PPE, and ask if they need anything else before I leave, and that's it.